Hello, everyone, and welcome to another episode of Secrets for an Inspirational Life. How are you all today? I hope that you are all well. I hope there's a little sparkle in your life at the moment, and that ever glowing hope that is always in the thread of life is still shining brightly. And, sometimes we forget that each and every one of us is an absolute miracle. We forget that here we are on this planet together at the same time, and that we were born and we were given this gift of life. And what a precious gift it is to be given life, to experience this beautiful and yet testing journey at times. But nevertheless, it is a passing journey to a far greater place. And we sometimes forget also that we are actually the place that we need to visit more often, and that place is deep within us. I am really thrilled and so honoured to welcome today my wonderful guest, who is Dr. Ashish Paul. Dr. Ashish is a qualified Ayurvedic physician and a medical herbalist. She has been practicing Ayurveda for over 25 years and herbal medicine for 17 years. She is a fertility specialist that provides medical treatment at a clinic in London, and also she works with clients worldwide. She specialises in Ayurvedic therapies through which she supports patients' health on all levels, and that is physical, mental, emotional, and of course, spiritual. Dr. Ashish helps couples on their journey of parenthood by improving their fertility with ancient Ayurvedic medicine and Western herbal medicine. She utilizes various techniques in her practice, such as meditation and yoga, to name but a few, to achieve the desired outcome for her patients. These therapies work with the natural rhythm of the body, treat the cause of a problem, and have less adverse effects. Her aim is to bring awareness to the holistic benefits of Ayurveda and Western herbal medicine. Dr. Ashish passionately speaks about protecting women's health before and after having children. She also educates people about the preventative methods to reduce the risk of diseases and how to live a healthy and fulfilled life. She's an absolutely fascinating lady, as you will learn today. And I am so excited to have her here because I know she's going to teach us all a lot about life. That's for sure. And I have asked her permission because she is a doctor, but I have her permission, of course, to call her Ashish. So welcome, dear Ashish, today.
Thank you, Mimi. Oh, that was so wonderful. Thank you so much. I'm so glad to be here sharing amongst with you, like-minded people, spiritual people. So thank you.
Oh, thank you very much, Ashish. I'm absolutely delighted to have you here. And as I said to you, I am so excited that you accepted the invitation because you are such a wise and knowledgeable lady. And I cannot wait for you to share that wisdom with us.
Ask anything you wish.
First, tell me, how are you today?
How am I today? I'm feeling very good today because this is kids are going back to school. One has gone today and the other one is going tomorrow. I have twins, by the way.
Uh-huh.
They're 14 years old. And so I am back on my desk. And, this is, as you know, after Christmas and everything. And today I've spoken to a lady in Angola for fertility. And another one in Manchester here in the UK. So it has been a wonderful day so far.
And it is a very noble job that you do, because I know it's fertility that is, you're the expert in that, but there are other aspects to your work which we're going to talk about. But before we go into that, tell us a little bit about where your journey began, because I was reading that you were a very spiritual child from a very early age.
Mm-hmm.
And that always is an interesting point, I think, because I think, as the saying goes, show me the child and I'll show you the adult. And that does actually stand for a lot of cases. So tell us where this lifelong mission of yours began.
Oh, wow. Yes, my parents follow a certain master, especially my mom's family side. So because of that, I was introduced to spiritual books very early on. I remember being 7, 8 years old and reading all these books, which you can only understand them much later. But I was used to doing that. I think this was something that was my spirit journey, I would say. Because not every 7, 8 year old reads those books, even if the books are in the house. And I had a heart surgery when I was 7 years old. This was the usual, hole in the heart, which didn't close, which it doesn't close for some babies, because it closes in the first 2 years of our lives. Everybody is born with this hole, by the way, but it closes for most people.
Really?
Yes, yeah. This is how nature is, to allow for the blood flow within the heart. But in the first year or so, and for most children by second year, it closes by itself. But in my case, it didn't, but I was still very healthy. So I had an operation, a 7-year-old, very successful. And it has been so many years now, 40 years or over. So I think I had very close contact with doctors at that time. I was in hospital for 2 months, and I was fascinated by looking at the doctors. I still remember going into operation theater when they took me. I remember everything, even till date. And I think that's where my fascination for being a doctor started from. I just always wanted to be a doctor. And I became one. Not a medical doctor, but I thought, as long as I can help people and I can practice, because in India, Ayurveda and modern medicine go hand in hand together.
Yeah.
And I worked in gynae and maternity for 5 years. And my plan was to open my own clinic. And I was very competent in what I was doing there. But then Jenny, shifted, got married, came to UK, had to redo a lot of things. And then that's when I did herbal medicine here in the UK, then did masters in Scotland. So this is how my journey has been. And gynae and maternity, I thought, even when I was doing that in India, my thought was that people are always going to have children. This is one field which is always going to be busy. And I would have liked, at that point, I was thinking of using modern and Ayurvedic medicine together and open a clinic. And now I have come kind of round circle to doing what I can do now, because I cannot work in the maternity field, because for that you need to be a modern medicine MD doctor.
Mm-hmm. Mm-hmm.
And but I now circled back, because we have 90% of our patients are women. By we, I mean complementary and alternative medicine practitioners here in the UK. So I was seeing more women, and then some women who had miscarriages started getting pregnant. And also that I have my own journey with IVF. I have IVF twins. Mine is a very straightforward success story. Went to doctor 3 weeks later, successfully pregnant with twins. They are 14-year-old this year. So, but that's when it just opened up into this whole, I was just horrified to see these women who have had 6, 7 cycles of IVF, because I only had one cycle. And that was my limit. I'm only going to have one IVF cycle, and that's it. And then I started meeting these women, 6 cycles, 7 cycles, and nobody talks about it openly, because it's all very hush hush. And that's when I thought, why are we not doing anything natural? And obviously now, many years later now, and I've been doing what I'm doing with this specific method that I use for last 7 years. And it's even more horrific to find what we are not doing, with women's health. So that's in a nutshell, I would say.
Okay, now IVF, you read a lot about it, but if you could, using your own words, Ashish, in a nutshell, what is IVF? Because you hear all sorts of explanations out there, and there's different forms and all sorts of things, but what is it primarily?
So IVF is in vitro fertilization. So it is fertilization in a test tube. So you take eggs from a woman, and you take one sperm, one egg, and one sperm, diffuse them together in a test tube in a lab, and an embryo is formed. And then that embryo is transferred back to a woman. That is what IVF does. And there are now lots of variations of it, especially to do with male infertility when we don't have good sperm quality. Then there are a lot of things that they can do with it. It's called ICSI, ICSI, and quite successful. But IVF, I think, overall, I always say this to my patients, to clients, or if I'm speaking somewhere, is that IVF as a technique itself is 100% successful. You have an egg, you have a sperm, you have an embryo. But to convert that embryo into a baby, which is full 40 weeks, is only natural. Conception only happens naturally. You can have the best quality egg and the best quality sperm and the best quality embryo, but they may still not stick inside a womb. So for that reason, we need the holistic health to come into it, And I think IVF overall is a very crude form of medicine for as far as women are concerned.
Yes, I mean, there's different thoughts out there. Some people think, well, if it's not meant to be, it's not meant to be, and then people don't pursue it. Then there are people who say, well, nature needs a little bit of a hand, of course, in helping people who are desperate to have children, understandably so. But you work, for example, with people who are already on that IVF journey, or do you work holistically as a separate entity or as something that's sort of hand in hand?
It's kind of hand in hand. I would love people to come to me before they start any journey to do with fertility, but that's not happening yet because that education is not there yet. Women don't know that they can reach out to an alternative practitioner and do something about it.
Yes, that's what I wanted to ask you, because I was under the impression that if women would try first a natural way to get pregnant and to, in a way, get their body prepared. I mean, people say to me, you're so simplistic, Mimi, in your thoughts, but I think there's a lot to be said about that in preparing one's body for such a huge change. And I remember, talking of masters, I was sitting once at a master's feet a few years ago, and there was a couple there, and the girl was really quite into her career, and the man was sort of, not too sort of career focused. And they said, we really want children. And he was older than her, and, we want children. And he simply turned around and he said, well, have you prepared? And they looked at each other and they said, well, yes. And he said, but have you really prepared? Because you have to have a body and a spirit ready to accept that child into your life. And that really stuck in my mind, because then I thought of you, because I thought, I wonder if that's what you do.
Oh, absolutely. Absolutely. All my work is from inside out. You cannot do anything from outside if internally you are not aligned. All our diseases, and I mean 100% of diseases, are psychosomatic. We have a psychological and spiritual component to it. And now, even the modern psychology is considering the spirit aspect, so which it wasn't considering before, but now there is a branch of it where they consider spirit, that there is a spirit element to everything that we do. So same with my work. It is my first question to my patients who come through to couples is, why do you want to have a child? Is it because your brother has one, or your sister has one, or the next door neighbor has one? Or is it because there is this um, in inner spiritual calling for you? Because so many times we see that too, when the going gets tough with fertility journey, it's very hard. It's so hard. I have seen relationships at the point of breaking point. Most of the time when I see people in my clinic, they're at the breaking point because they come at that point. They come 4 or 5 years into their journey, and by then they have spent their resources, their money, their emotions, and you name it. And then it's so difficult, and they're pulling their hair out, not knowing what to do. That's because we are trying to put band-aid on band-aid on band-aid on a wound, and we're not healing it from within.
Yeah, it's true. It's true.
So my work is start from inside. Why do you want to have a kid? And then work on all the aspects of your well-being, your health, your spirit. You need to be so well aligned that doesn't matter. The mountains can move, but you are focused on what you want. And it is not about, okay, one cycle after another cycle of IVF, another one and another one. It is so maddening to be using so much hormonal medicine. We are really sitting on a time bomb as far as women's hormonal health is concerned. Because now with IVF and even with other conditions like PCOS and endometriosis, the intervention that we have from medical field is all hormonal. And you might know this already, but hormonal medicine is steroids. Okay.
Yeah.
So all contraceptive pill that you're taking every single day for years, sometimes you are putting steroid in your body every single day. And same happens with the IVF drugs, same happens with endometriosis and you name it. So it is about coming from within. You need to be very aligned. You need to be aligned as partners, whoever is in this journey with you. Are you on the same page? Because I've seen people falling apart. So you are right. It is not just only about using, what we can do medically. And I think any doctor, whether medical or whatever that doctor is or practitioner, if they do not consider a holistic aspect to anything, it's a very narrow-minded view. There is so much evidence, so much evidence into how unless your mind and your body and your spirit is aligned, the healing is not going to happen. The fertility is not going to go ahead. You can have as many cycles as you want. And sometimes when I look at people who have had 4 or 5 cycles, some of them are just useless in a way that they haven't really done anything, because they didn't work on themselves. They didn't change the diet. They didn't change the lifestyle. they didn't do anything. You can go to a doctor today, to an IVF clinic, and ask them to, as long as you pay them, they'll start you tomorrow without any prep.
Yes, that's right. Because sometimes what we think we want and what we think that we desire, we're absolutely unprepared for in life.
Yeah.
And it is a journey into finding out about who we are, I suppose, because some people will say to me, I know people with children and people without children, and they'll say to me, the ones without, yes, but how did they manage to get pregnant so quickly? How were they able to have it? And I try to say, in a very sort of calm and kind way, but we're not all the same. None of us, not one individual is the same. We're all completely different people. We're all completely different beings, and our health is something that's individual to us. But people run to find a cure, but it's not a cure, as you say. It's actually a cover-up of an existing condition that you keep closing the door, or to refer, as you said, a Band-Aid, and you keep putting it under the carpet and shutting the door and putting it under and shutting it and shutting it and shutting it. When in fact, really, what you need to do is rip it open. And however difficult that is, unless we confront ourselves with ourselves, I don't think we can have health at all, can we?
No, we can't. I mean, I have seen and I see women walking into clinic, and I've spoken to many of them where they don't even have the time to come for consultations or come for therapy work. Now, how are you going to find the time for a child?
Yes.
When you think from a spiritual point of view, a child's going to take all your resources. If you right now are not preparing, not putting that time into your schedule right now, I don't think you're going to like it when the baby is here. Yeah. And babies are for life. You can't send them back.
No, it's true. It's not a dolly. Yeah.
No.
True.
So I think it's also the fact that, IVF is seen something like, I don't know how it has become this way, as if it's a miracle cure. Oh, I can have IVF. As long as I have money, I can have IVF. You can spend all the money you want. If it's not going to work for you, if you're not prepared, it won't work for you. And I know people who have spent £1 million on cycle after cycle. Oh, yes. It was in the news about it's two gay fathers, who have spent £1 million. Obviously, they needed a surrogate, but the whole journey, going through the whole thing, it is. And just think about places like America. It's all private medicine. It is horrendous, the amount of money that you can spend on it, where you can do, as you just mentioned the word simple, you can do such simple things to prepare yourself.
Yeah.
And I say to my clients, you can work with me if you can only come for one consultation. I'll equip you enough. If you are intelligent enough, you can go home and work on it yourself. If you don't have any more money, or if you have more budget to invest in it, I can coach you, go through with you with the whole thing, because there are so many fireballs that are going to be thrown at you through the whole journey of IVF and overall health as well. You don't know what's around the corner because we can't see what's happening inside our bodies.
Yes, yeah, that's that's the actual sort of labyrinth, isn't it? That's the maze within us that we really don't know. We seem to think that we know everything outside of us, but that's truly impossible, because unless we know what's inside, what's going on inside of us, I don't mean sort of mechanically even, I mean, if we don't listen to our body, the signs that our body is sending. And I'm a great believer, Ashish, in that the body will send you a sign, it will send you a signal, it will send you the pain, because it's trying to communicate. And I think that if the soul is healthy, the body is healthy. I'm a huge believer in that. So, but I'm interested in this. So let's imagine, because I want to find out what sort of help you're able to offer for people out there. But before we do that, tell us a little bit about, because I'm such an absolute convert to Ayurveda. I love it. I adore it. Tell us a little bit about that, so that listeners out there who haven't heard of it can have a little bit of more information about it.
Oh, sure. How many hours do you have, Mimi?
We will talk again anyway. Ashish and I are going to have conversations, because I want to learn so much from her.
I'll tell you briefly. Ayurveda the actual word comes from two words. Ayur means life, and Veda means to know, to have knowledge of. So it is knowledge of life in all its forms. And there are four forms of life: happy life, sad life, healthy life, and unhealthy life. And it is life in relation to the rest of the universe as well. Because Ayurveda believes you don't live in a vacuum, you live in connection with everything else that is around you. So you can only be as healthy as healthy as your environment is, and you can be only as healthy as your mind is or spirit is, and uh, your food is, and your air is, and water is, so it is an art and science of living. How do you live your life? And 90% of Ayurveda is about prevention. It's a preventative medicine, and there is nothing like Ayurveda in terms of prevention. No other system goes even close to what it has to offer, in terms of all the signs and symptoms that you can see from pulse, from different diagnostic features from your body, what your body is telling you, as you mentioned, signs and symptoms. Um, and then how to live your life daily, so that you don't get sick. When you do get sick, then we do, of course, have all the herbs and therapies. And Ayurveda has got such extensive therapies, body therapies, internal therapies. We also have a branch of surgery, which we call Ayurvedic surgery. In India, we can do that, and using all the herbs and everything. So Ayurveda really is the oldest healthcare system. Modern medicine comes from Ayurveda, we know that. Chinese medicine comes from Ayurveda, we know that, which is why there are so many similarities with Chinese medicine. But Ayurveda has spirit built into the system. Without spiritual element, without psychological element, there is no Ayurvedic medicine. And Ayurvedic medicine, or if you want to live in an Ayurvedic way, you have to know yourself, what we call your personality, we call it doshas, how you are as a person. How do you think, how you behave, how you eat, how you digest, how your sexuality is, how your sex life is. All of that is part of you. And every single human being, even the identical twins, are unique. So whatever is suitable for you is only suitable for you. It's not going to be suitable for anybody else. So this is how Ayurveda is in a nutshell. And we always start from finding your constitution first, and everything else is based on that constitution. So if you are we have Vata, Pitta, Kapha, as you know. So if you are a Pitta type, then what kind of food you can have, what kind of clothes you can wear, what kind of colors you should have around you, what kind of gems and stones you can use, what kind of diet and nutrition you should be having, what kind of thoughts or yoga you should be doing. Everything is based on your constitution. And I am just amazed by the beauty of Ayurveda. The whole of Ayurvedic text is written in Sanskrit, and all the books, which are the original books written in Sanskrit, they are written as a poem. So they are all in prose. You can sing it. Because you remember, it was an oral tradition passed orally down the generations. So people used to sing it, and it's easier to sing something rather than remembering otherwise. So we call them shlokas. Like poetry, there are 4 lines to it. So within those 4 lines, it will mention about the signs and symptoms of TB, what to do about TB, the herbs that are good for TB, and then all the mantras that are good for. So in those 4 lines, you have everything to do with one single disease. And it's just absolutely fascinating. I mean, how did they come up with it?
Oh my goodness. How beautiful is that?
Yes.
I don't claim to absolutely understand the 3 doshas. Is it 3 doshas, isn't
yes,
it?
3 doshas.
That there are. But all of us have a part of that dosha within us, and then one is more predominantly us. Is that how it is?
Sorry, say that again.
So, for example, the 3 doshas. They're saying that there are 3 types of doshas, and is an individual a one dosha on its own, or is it a combination of that and then there's one predominant one that's the main one?
Yeah, there's generally two predominant ones. We normally have dual dosha type, and out of which you always take the dosha of the mind. How your mind works, that's your predominant dosha. So if your mind works in a vata way, your body is going to behave in a vata way, because mind is controlling every single aspect of our life. So same with pitta and same with kapha, but we have all the three doshas within us. It's just that one of them is going to be the main one, then there is second one. So those two are the top ones. And the third one, in some people, may be a little more balanced, and some people, there might be nothing much of the third dosha. And then you can see the imbalance then.
Okay, and the doshas, for people out there who are not familiar with it, what are the doshas?
So the doshas are what we call humours. They're also called humours or temperaments. They are basically the real fine aspects of our physiology. Yeah, how much nervous system is active in one person as compared to the other one. They will be more vata type. How much biochemicals are released in somebody's body, they will be more pitta type. How much phlegm is in one particular person, or water content, they will be more kapha type. So these are actual physiological aspects which form your doshas. So it is about, I think those people who have designed this whole thing, they were very observant, because in those days when there was no microscope, nothing of that sort, and to come up with all of this is just, for me, it's a miracle. But that's what you can equate it to. So we have the actual, all these biochemicals and how your physiology works. That's what is translated to three doshas.
And that's something that you are able to read, is it, Ashish? So that when a patient comes in to your clinic, tell us a little bit about if somebody out there needs help, do you just deal with fertility, or are you able to deal with a person, whatever their issue?
Now I'm dealing mainly with fertility and gynae. So gynecological issues, or if there is any PCOS or endometriosis, even if they're not looking for fertility as such. So I'm dealing mainly with that. Yeah.
Okay, so if someone comes on their journey before they want to go down the IVF route, what would be the protocol, so to speak, of of someone coming into your clinic? Whether that be, because you deal with Skype, don't you, and Zoom, so anyone around the world can contact you. It doesn't have to be. Yeah. So how does that consultation work?
So we can do everything apart from obviously doing one-on-one work. I do a lot of detailed consultation, and if you are very thorough, you can get most of the picture without going through pulse diagnosis, for example.
Yeah.
But the bottom line is first to find out about their past medical history and also about their doshas. These are the two forms that I send to people. And then, yes, they can be sitting in any part of the world. I talk for a long time, have a long discussion with the patient, going through everything about their aspects of their life and their bodily systems as well. And then based on that, we make bespoke management plan, how they want to work. If somebody is physically not present here in the UK and they want to work remotely online, I will do everything what we can do that way. The only part I will not be able to do is therapies. But I sometimes in those countries, I'll ask them, for example, to go and find out if somebody does fertility massage there. And then I'll ask them to, have these many sessions of fertility. So I can coach them what they need, but I will not be doing the therapy part. But rest I can do. I post medications and stuff, internationally, anywhere, wherever they need Ayurvedic medicines.
Do
And
you use herbs as well?
I do use herbs. I
Mm.
give. I'm sort of a minimalistic person when it comes to medicine, even if it is natural medicine. But when it comes to fertility, we need to do this because most of the fertility clients don't have the time. Time is really against them, you know. So they're trying to enhance their fertility in the smallest amount of time. So I do give then high doses of herbs that I use in my practice. They're all Ayurvedic natural herbs. And I do use essential oils as well, and some of the supplements that I use for fertility. And then there is diet and lifestyle advice, and for men and women. And I also advise about their sexual intimacy, how they should be behaving with each other in order to get pregnant. And, I train them with NLP techniques because I'm an NLP practitioner also. So I do fertility meditations and yoga combined with that. And generally, we record these sessions, which people then can play to themselves, especially NLP recordings. So yeah, it's very, very, it's very extensive. And my method of this, I call it, it's rejuvenating your fertility, because that's what I'm doing. I'm rejuvenating people's fertility, eggs and sperms. And it is very unique. There's nobody doing this amount of work on a fertility patient. So yeah, it's very involved.
And is it, for example, like a course of, I don't know, 4 weeks, 8 weeks? How long does it take, or is each individual different?
Yes, if you have all the money in the world, you keep going until you're pregnant. Yeah. And we can do that with herbal medicine. Totally. There are a number of therapies we will do every time, around the time of ovulation, and herbs, and accordingly, you keep going on until you're pregnant. But in the case of when I work with IVF clients, I normally ask them to give themselves 3 months at least, because we need 3 months for new eggs and sperms, or for any change, for good change to occur in your eggs and sperms and your body. You need about 3 months. So I work with them one-on-one on 3 months, where I do a lot of intensive therapy work with them. They have to come to clinic for 8 days, and then I give them medications, herbs, and also, as I mentioned, fertility meditations that I do. If they're working online, then it is a 6-week course, and I will guide them on 6 different aspects of, which is in all the aspects of their life, little bit by bit every day. And they get these instructions from me every day. And weekly, we will meet and discuss if there's any problem, any questions, we go through that. But that kind of work is only suitable to somebody who's just in the beginning, who's just started. People who are down the line of IVF, or people who have been over 2 or 3 years, they definitely need more therapy work. They need one-on-one work.
Okay, and it's something that you support that individual, or is it that you support the couple?
I can support both. I do work with men also. I don't generally work with other men for other general things, but for fertility, I work with the husband or the partner of the couple. So I do, yeah.
And what sort of thing, because I know there's a lot of men out there who will be interested in this, what sort of work do you do with the men?
Same work, same therapies, same similar herbs, not same herbs. Some herbs are different for men and women. Same work. Both partners can do exactly the same work with me. And actually, men should also do more, because 50% of fertility, or 50% of the baby, comes from genetically from the man's side. And it is also because men's fertility is really downgrading, sadly, and they should do more work on enhancing their sperm count.
Yes, I've heard this also from colleagues of mine, that fertility is actually, even in younger men, has declined dramatically over the years.
It has. There was a major study published I think 4 or 5 years ago. And since 1970s up to now, it has reduced 50%.
That's a huge amount.
That is massive.
It's a huge amount.
Yeah. So there are huge issues with men's fertility. And then, my most contentious point is that even when it's a man's issue, it's the women who end up having all the medications. If you're going through IVF, even if you are totally healthy, and then there is an issue or even a tiniest issue with the sperm, then you're going to end up having all the IVF medication or other medications of any kind. So that's why women need to protect their fertility, their health even more.
Yes, and it's a journey for both parents. I know that I have a friend who couldn't have, his sperm, the quality of the sperm wasn't, I suppose, robust enough to achieve, the combination with the egg. But through IVF, they did it. But even so, it's a very traumatic experience for the man, which sometimes, we forget that it's actually also dramatically stressful for both, people in the relationship, not just the woman or not just the man, but, together it can cause huge issues, can't it?
It's highly stressful, and it is now recognized as PTSD for couples who go
through. Is it really?
Yes, it is. Because PTSD is a chronic stress or a stress of a huge event, and it is a huge event to lose a baby at any point in the journey, whether that baby was only 4 cells big or whatever number of weeks you were pregnant. And with that baby, you lose that whole world that you created for yourself, So it is not just a loss of a simple embryo. And that is why it is now recognized as PTSD. And it is a huge chronic stress, because I think it is only very unique to fertility is that this question, whether you are pregnant or not, is every single day. Every single day you are thinking about it. Am I pregnant today or not? Am I pregnant today or not? And just imagine, for some people, that has been the reality for 5 to 7 years.
Yes, if not longer. Yeah.
If not longer. And that is tiring for your brain, for your cortisol levels that are going high and high and high. And also there are studies to prove that even when you do end up having children, still the whole journey and the experience that trauma doesn't go away.
Yes, it's something, especially I have a friend who had many miscarriages, something like 15, Ashish, and it still affects her to this day. She then went on naturally to have 2 children, but even so, the loss of these children, 15 times losing a child is hugely traumatic.
Oh, that is very sad. Yes.
Yeah, it's sad. But what advice could you give to men and women out there? Because as we said, the fertility is really, really dropping substantially and at a rapid rate, it seems, for various reasons. What is the advice that you would give people out there?
I think that advice which would be the same for any health overall about your health, is that you need to look after your health. You need to start early. You need to get things in place earlier. And I think because there is not enough information out there for women, and also too much reliance on the fact that, oh, yes, we have IVF, that women are sometimes not even given the option of anything natural. So my advice for fertility is that as far as women are concerned, they do have a biological window, sadly, because fertility after 35 does reduce very, very dramatically. And you need to plan your life accordingly so that if you are someone who do want to have children, then you don't miss out on that opportunity. And we are seeing that more and more women are now freezing their eggs. And my advice would be to anybody who's around 30 and not sure yet of anything, they should freeze their eggs, because at least then you have a chance. Healthier eggs of under 35-year-old woman have more success rate, even if you then end up having IVF after 40. Yeah. So rest is about your fertility health, and you need about a year to prepare for your to conception. So whenever you want to have a child, you need to work backwards from that time period. And you need at least 1 year to naturally for it to work for you. And if you are somebody who has been on contraceptive pill for a long time, then you need a lot of cleansing.
Yes, it's a huge thing to think about. And I think sometimes we take it for granted, our health, at certain times. When you're young, maybe you don't think about the treasure of having good health, but it's something that is really important, especially for people who want to have children. And it 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 pays in all sorts of ways to start early, like you said, to look after your health. And stress plays a big part in that, doesn't it?
Stress, what we are finding is medically is the what we call the aging of eggs and sperms is happening much faster. And that is what is reducing the fertility. And for men and women, for both, men is decreasing, as I said, drastically. So it is about, it is about overall health as well, because eventually nobody knows what actually contributes to the health of the egg and sperms. It is overall health. You need to be overall healthy. And that means healthy in your mind, your body, your spirit, your emotions. All of that has to be in place for you to have a good egg and good sperm. So, yeah.
It's a fascinating subject. And how does it make you feel, Ashish, to know that you have helped people to bring this joy into the world? It must have a very humbling effect on you.
Oh, absolutely. I mean, I'm just a small part. If I can shift a little bit for someone and for them to, I see those little tiny ones walking into my clinic sometimes.
Oh.
And it's so lovely. It's just so joyful for somebody who wants to achieve a goal and you get it for them. And I think babies are one of those, it's one of those things you would call them. It's something that is just, there's no words for it, And that's how my experience is. I just want women to not just only have children and in the run to it, not lose their health. Because as my consultant used to say, you need your health afterwards, because you need to be healthy enough to look after the children that you are bringing into this life.
Yeah, absolutely. Yeah.
So yeah, absolutely. It's very satisfying. And I work very, as I said, very involved and very emotional and spiritual way with my clients. For me, they become part of family and bigger, larger family. But yeah, it's beautiful to see those children.
And do you believe that it's maybe a very difficult question? I don't know, but Ashish, do you believe that ultimately it doesn't matter how much you try, it is sort of a little bit a hand of destiny on these things?
Yes, I think destiny has a part to play in everything if you are spiritually oriented. There are mysteries of life which we don't know. And I also feel that you can change your perspective a little bit and look at that way. to shift your perspective on these things, whether it's to have a children. If you think, okay, I'm going to have, like one of my patients used to say, I'm going to have a child. From day one, she came into my clinic. She said, I'm going to have a child. And she did. She used a donor egg, but she did. She has a beautiful baby girl. But I feel that attitude where you are pliable enough to mold into the way of the spirit,
Yes. Yeah.
Because if you're very rigid, that you want it your way, you want only your biological child, then things can then desperation comes into it, because you are not going with the way of the spirit, But if you are open enough to say, I want to be a parent, or I want to be a mother, regardless whether I have a biological child or, and there are a lot of things in it. Some women want to be pregnant, and there are some women who don't necessarily want that, but they want a child. So, it's really that. But yeah, I feel you do make your own destiny. But yes, it is, because fertility is not only dependent on one person, it's dependent on two people.
Yes.
That's what makes it more complex.
Yes, I mean, it's the dance of life, isn't it, between two people. And it's a magical dance. And yes, it's true, because I think if we raise our energy to the point, as your client there, that was adamant to have a child, I suppose that works in all areas of life. If you are sure and your spirit feels it, and your spirit is dancing in that energy, then things are possible. But if you are sort of existing in a sort of low energetic field, then there is not much hope of anything, so to speak, happening in any sense in your life.
I agree. It's about vibrations, and I'll share briefly. I think time is probably coming to an end. But my own thing with the IVF, you mentioned in the beginning that people think, oh, if I'm meant to get it naturally, I will have it naturally. I thought the same. I thought if I'm going to have it naturally, I'm going to have it naturally, And then I thought, what if my destiny is through this? And now I know the kind of work that I'm doing with the women. I knew that I needed that experience to go through it once even. And you believe me, from the moment I always thought about children or having kids, I never had a doubt in my mind, even when I was a young girl, that I will ever not have children. It never occurred. Okay. We had children 10 years into our marriage. And before IVF, I thought, okay, if I'm going to have IVF, I'm going to have twins, a boy and a girl. And that's exactly what I had. And not even for a moment I ever had a doubt that it won't happen.
That's incredible, actually.
It is absolutely incredible. And I see this in my patients, where your spirit is so strong, that I'm going to have it no matter what. You tell me what to do. That's where you see the result much faster.
Yes, because you have to be willing to be on that same level with people also. Because if you think about when we are with different people, we're attracted to the people on every level who are somehow resonating on that same level as us. And it's that gives sort of our spirit wings. If we tend to be with miserable people, I have to say, and people who always want to see the worst in life, I think it's absolutely impossible to achieve any form of goodness or success in life, because it's two energies pulling in a different direction.
Absolutely. And I think that goes for everything. People who, even in their madness, feel healthier, they will stay healthier. We know this. We know this from endocrinology. We know this from neuroscience. If you are a positive person, you're going to remain more healthier. and you're going to have that perspective. It's the same in fertility. If you're a very doubtful person, it's very, very difficult to control those nerves, especially when fertility journey is long. And even for health, I mean, my perspective on my health is that I am always healthy.
Yeah.
That's it. So that's my perspective on my health. I don't like to moan about it. I don't like to talk about it. And I'm never generally not sick for anything. I mean, we have been through this whole COVID situation, for 2 years, but nothing. And I'm not vaccinated. Neither are my kids, but we have been clear so far.
That's a huge testament. That is a very important thing, actually, because I have a friend of mine and he always says to me, Mimi, you have to think healthily. Because as soon as you start to think, I don't feel well, you send messages to your body and the body listens. So it's important to think with your mind healthily and not to sort of have a suggestion there that you're not well.
Yeah.
Of course, illness happens and ill health happens, but how much of that, I wonder to myself, is because we have caused it through actually being in a negative space.
We're calling it for ourselves,
Yeah.
We are manifesting it because we lower our vibration. Every moment, every thought of doubt is lowering your vibration. If you think of yourself and we are vibrating beings, right? So we are like waves. And every single positive thought, when you are happier, when you think positively, or positive thought means when you see goodness in everything, right? So that thought is going to create that vibe and it increases your vibration. So this is why spiritual people are more happier. Because they have that vibe. And we know this now because there are actually magnetic mats that you can lie on to increase your vibration.
Yes, I saw that. I've tried magnets, Ashish, and I find them a bit strange, I have to say, but I know people swear by it. But I also tried, the mats that have those spikes on them. I can't remember what they're called. And they're mats that you lay on and they have plastic spikes. And they're really good as well. So it is, again, the most simplistic things. If we keep ourselves on a very simple level, working with nature and in a way, appreciating that for everything out there, for every condition that we have a power, so to speak, within us, a divine power that we can ultimately engage within that power field to help ourselves, whether that be mentally, physically, or spiritually.
Absolutely. And that's the thing. People give their power too easily away to other people, to doctors, and doctor knows best. Your body is giving you signal every single moment of it. You just have to be, wise enough or in tune enough into your body. You ate something and it's giving you bloating. It's not good for you. There's no point in having another something to, get rid of that bloatedness. You need to look after that, whether that food is good for you or not. So body is giving signal all the time, but we are not in tuning into ourselves. And also we are not trained that way because it's like going to doctor will give me something and then it's going to get better. That's a huge difference of perspective, how people view their health. And you're right. It's because I have learned this behavior from my grandfather, especially, and my dad, is that, we are always well. My health is always good. So I've learned that for myself. And luckily, I am also very good because then I found Ayurveda, and Ayurveda is helping me with this.
Is Ayurveda something, Ashish, that your family have practiced when you were a child?
No, no.
No.
No, Ayurveda is not in my family at all. Not even doctor. We have a distant uncle who is a doctor. But otherwise, my grandfather, my grandparents, both sides were very spiritual and very, very learned. So I think I have some of that passed on to me, for sure.
Something passed on, and that is actually the strongest power, is when you have something that's passed on through generational links, because that is actually when you are meant, so to speak, you are meant to do something. You are meant to, that work is written for you. It is not a job. It's more of a vocation, a calling in life. And I knew that you were coming on, obviously, today, and I was thinking about you yesterday because it reminded me, funnily enough, of my great-grandmother, who was very much into herbs and into natural healing. And when I was sick, when I was 7, I had pneumonia, and I've spoken about this before. And what's important is that none of the drugs that I was being given were working. And I do think that modern medicine has its place. Absolutely. I'm not denying that. Absolutely. But also, I feel that hand in hand, we should look at the complementary therapies, because what she used and the herbs that she used saved my life. And that really showed me that there is an alternative to, the things where, pharmaceutical companies are good at curing some things, but equally, unfortunately, one of the side effects of that is that it can cause other conditions. It goes with the territory, doesn't it? It's just the way it is. So I think it's important, especially here in the West, to learn about these things, to have people such as yourself, to teach people out there that there are different ways of healing.
Absolutely. I think we need more of that. I am a proponent of integrated medicine because I think natural medicine has its place. It's very quick. It deals with the symptom very, very fast. But we just to rely on modern medicine, because I think modern medicine is very crude. You have same paracetamol for billions of people, and every single human being is an individual. So that is the downfall. Actually, side effects we know kills more people than any other disease of modern medicine. So, we need a model where you need quick fix, you deal with the symptoms, and then you put those people onto herbs and therapies. That is the model we need for us to go forward, for us to actually have better health, because health is just going down the pan for most people.
It's really quite sad, Ashish, because mankind has developed in some things fantastically and in some things not so fantastically, I have to say, to the detriment of themselves. And when you look around, people are so afraid of everything. They're afraid to live. They're afraid to do anything. They're afraid to follow their dreams. They're afraid of their health. And realistically, if we took the power back into our hands, our health back into our own hands, and became responsible for our life, I wonder how different the world would be.
Well, all we need is Ayurveda.
Yes, absolutely. And herbal medicine. I'm a huge advocate for that. I thank you so much, Ashish, really. It's a gloriously fascinating subject about, new life and birth and children and the hope for the future. And, I remember when I was young, I was in school. I don't know how old I was, maybe about 13. And we had a teacher and she said, "Oh, when you see a baby born, you know that God hasn't given up on us. And I always think about that. I think, well, people are still having children, I was like 14, 15, teenage years, and you're thinking, oh, how it is. You go through all of that as a teenager. And then I had this thought of my teacher who said, as long as there's a baby being born, God hasn't given up on us. And I suppose you're helping God in a way, aren't you?
Well, it definitely is a beautiful miracle of life,
yes.
To
Beautiful.
be able to have a human being inside you is just amazing. I mean, I still wonder, how did I have two of them?
You're a walking miracle. We are a miracle. And that's the beauty of it. And we should remember that more often, that every single one of us was at some point born. I think we forget that. And came into this world as a miracle. And we can do so many miraculous things, I think. And that's the beauty of life. And before we go, Ashish, in a little paragraph for people out there listening, something that has helped you in your life and that can help people at this time to remain hopeful. What advice would you give?
To remain hopeful, one thing that I always say to myself, and I have had some personal challenges last year before, last couple of years as well. And I say to myself, but I can do a little better. I can go on. I'm not going to be let down or put down by this thing, whatever that thing may be, whether it's fertility challenges, whether it's health challenges, whether it's less money or financial issues or COVID or whatever else. So, it has to come from within, something that you feel inside of you. But I say this to myself a lot, that even when I'm feeling very down about one of those days, then I say, no, but this thing can't win on top of my spirit,
Yeah.
So that's my message. Just go a little bit, just to take a rest and do it again.
Yes. Fall down and wipe your knees and get back up again. And there is nothing more powerful than the human spirit, I don't believe. No. I think it's, sound advice. It's good advice. And for people out there, Ashish, that would like to contact you and possibly come and see you, or whatever, you do Zoom or Skype as well?
Yeah, Zoom, Skype, any online method to get in touch. If you're not in the UK, I practice from Harley Street in London. I do practice from Essex Small Clinic in my home also. And Ashish Veda is the name of the professional name that I go by, and you can search it up anywhere.
And what's the website? Is that Ashish?
Yeah, ashishveda.uk.
Okay, so that's the website, and you're happy for people to contact you?
Oh, absolutely. I would love to help out more with, women who are just thinking, oh, this is the only way and this is the dead end for me. I would love to speak to them.
Wonderful. Oh, what a fantastic job that you do, Ashish. My goodness. I think it's amazing. Wow. Bringing new life into the world, being part of that beautiful connection with the life source. I think it's beautiful. And thank you so much again for coming today and inspiring, really, us all. I can certainly speak for myself, and it's been absolutely wonderful. Thank you.
Thank you, Mimi. Thank you so much.
And look after yourself, and do come again. And
sure. Anytime. Ayurveda is vast enough for us to talk about.
Yes, it is. It is. I could talk all day about Ayurveda, actually. But thank you again, and I wish you a joyous day.
Thank you so much, Mimi. Thank you. Bye-bye.
Thank you. Bye-bye. Bye-bye. Ashish Paul. What a lovely lady. Thank you so much in joining me today. I wish you lots of precious moments and beautiful times. Until next time, look after yourselves and lots of love.
Thank you for listening to Secrets for an Inspirational Life, brought to you by your host, Mimi Novic. Please remember to subscribe to the podcast, and see you in the next episode. For more information about Mimi Novic and her books, music, and inspirational work, take a look at her website, www.miminovic.co.uk.